Allergy sufferers are being urged to stay aware of the symptoms and signs of potentially life-threatening anaphylaxis, with the risk of getting stung by a wasp increasing. The risk of getting stung by a wasp is highest in September, and the recent heatwave has intensified risk even further. Guidance from the National Institute for Health and Care Excellence, NICE, said stings caused more than 70% of all deaths from anaphylaxis in the UK between 1992 and 2013. The Anaphylaxis Campaign has highlighted the dangers of anaphylaxis from wasp stings and the importance of awareness, prevention and treatment options to beat the condition. The charity said wasps are most active in September, and warned people it is the most critical time to be vigilant against wasp sting allergies. Experts said the prevalence of allergy in the UK has been increasing at an alarming rate over the last 20 years, and the number of people being taken to hospital because of severe allergic reactions has increased 7 times in the last 10 years. Professor Steve O'Hickey, a consultant with a special interest in allergies from Royal Worcester Hospital, said, "The exact reason for this growing allergy epidemic across the UK is unclear, but it is likely attributable to 3 key factors: a general increase in incidence, an increase in the severity of these incidents, an increase in the complexity of these more severe and common incidents. Seasonal allergies, especially insect allergies, are becoming increasingly common, and as the latter end of the summer approaches we do receive an increase in incidence of anaphylaxis as a result of wasp stings. The heat wave, set to last 3 days, is expected to increase the aggression and persistence of wasps, as it becomes uncomfortably hot for them inside their nests. Hot weather also leads to improved breeding conditions for wasps and a higher prevalence of the insects they feed on, which means they are more likely to thrive and be higher in numbers than would normally be the case. The charity said 1% of the UK population is at risk of a sting that can provoke an allergic reaction, and a small minority of these people will go on to develop the potentially fatal allergic symptoms of anaphylaxis. Symptoms of anaphylaxis include itching commonly affecting the palms, soles, groin area and scalp, general hives, swelling of the lips, tongue or throat, difficulty in breathing, tightness in the chest, faintness or dizziness, and a feeling of fear or impending doom. In an emergency, people are advised to use an adrenaline device without delay if there is one available. Dial 999 and keep the patients as still as possible. Allergic reactions at the site of the sting do not require emergency treatment. Cold compresses or painkillers can be used to stop the burning sensation caused by the sting. Keeping a swollen limb elevated can also help to ease the pain, and antihistamines can be taken to help reduce swelling and itching. For people who suffer from a large local reaction, steroids can help to speed up the healing process. The earlier they are used, the more effective they are. In the case of a larger reaction which may require steroids, always seek advice from a doctor or nurse first. Sufferers who have experienced severe allergic reactions should be referred to an NHS allergy clinic for further assessment. In people with confirmed allergy, a longer-term solution may be venom immunotherapy treatment, VIT, which can change the way a patient's immune system reacts when stung and is effective in preventing anaphylaxis in the future. Lynn Regent, Chief Executive of the Anaphylaxis Campaign, said, "September is about enjoying the last of the warm weather, but for those who have experienced a serious allergic reaction to a wasp sting in the past, it's a time of increased anxiety as the chances of getting stung, potentially fatally, significantly increase." The Be Resistant campaign is about raising awareness of anaphylaxis and educating the public on the dangers and symptoms to look out for, as well as the treatments that are available that can dramatically reduce the potentially life-threatening effects of getting stung. Watch more videos at video.5la.net.